Hello and welcome to the Penny Dee Podcast. This is for you if you would like to sit for 20 to 30 minutes every month, relaxing your mind and just listening to my ramblings about life, love, happiness and much more. I'm your host, Penny Davis, and welcome to the show. Welcome to the show, Heather.
Hi, Penny. Thank you for having me.
So, Heather, it's my pleasure. Please tell us what it is you do.
Well, I'm an author, I'm a nurse and a hypnotherapist, and I run a private hypnotherapy practice called Female Health Hypnotherapy in Stockport. And I specialise in supporting women with female health issues and managing chronic pain conditions. And then more recently, delighted that I've published a book called Optimising Recovery from Vulval and Vaginal Pain. And the book's been written to empower and support women living with intimate pain conditions.
Because I'm learning from you, this is a really common issue, and you have a story about this yourself and how you got into it.
So it's surprisingly common issue. I think it's almost like the last taboo in that it's very rarely talked about. But it's up to sort of 16 to 18% of women, according to the research, have persistent vulval vaginal pain conditions. It's also anticipated that it's actually more like around about 25% of women, because obviously there's the embarrassment factor and some women might not present to the doctors. And also it may be underreported by the medical professions who don't recognise it.
Right, that's a pretty scary statistic, isn't it? Are there any particular age group that suffer with this?
It's a great question, Penny. So it actually affects women of all ages. So anything from kind of the age of puberty through to older age. So the primary ages are during reproductive years that we see it. Sometimes women also get issues during perimenopause and menopause. So yeah, across the whole lifespan.
And I would have thought the only time I've ever heard it, and I've only ever heard one woman confide in me about it, and believe me, that I speak to a lot of women, and I hear a lot of things. It does seem to be the last taboo, and not much known about it. Certainly not really spoken about, particularly these days when we do speak more about menopause and women's health. And the context that I heard it in was around menopause. But if you'd like to share a bit of your story with us about how you really got into this area, that would be
great. Absolutely. So I had originally trained as a nurse from the age of 19, and throughout my nurse training and my career as a nurse, I suffered with recurrent urinary tract infections, UTIs. Very, very common amongst nurses and teachers and any other profession where you can't easily get to the toilet. So you tend to hold on. So yes, I had this history of recurrent UTIs, and that unfortunately developed into Vulvodynia as well, which is chronic pain in the vulva. So that carried on really from the age of 19 through to about 40. And then at 40, I became incredibly unwell with persistent vulval pain. It was caused by a fairly standard fungal infection initially, but unfortunately that developed and persisted, and that caused me to have nerve sensitization, pelvic floor dysfunction. So the muscles in my pelvic floor became very painful and tight as well. And it probably sounds like it's just one of those things you should fairly quickly recover from. But actually it was completely debilitating. I wasn't able to walk, sit, drive my car easily. I certainly couldn't work. Obviously things like sex were out of the question. But even on really practical levels, Penny, I couldn't wear trousers. Most days I couldn't even wear knickers. It was just so excruciatingly painful.
Now, a word from our sponsor. Do you want to address the signs of aging or menopausal skin? Does your skin feel dry or sensitised? Try my very own brand of skincare. Skin Goal Skincare is a powerful, clinical, yet luxurious range of products, all designed with you in mind. Try it today get 15% off your first order. Use the code podcast15. Enjoy. Now back to the show.
So I embarked, as many women in this situation do, going to countless GPs, nurses, clinics, trying to get answers. And that was such a mixed and often just desperately upsetting experience, because despite being a nurse and despite being able to really well articulate and explain my symptoms and what was going on, I was often met with my pain just being dismissed, or there was a general sort of lack of knowledge about what was happening. And I just felt utterly lost. And then after 2 years, I had a particularly distressing and misogynistic experience with a gynaecologist, where I was effectively told that the pain was in my head and that it was because I didn't want to have sex with my partner, which was far from true.
Heather, I am absolutely...
It was horrific.
Yeah.
It was absolutely horrific. My husband was so upset. And luckily, you know, we've got a really great marriage. He's very supportive. He's been wonderful throughout the whole of this. But we were both distressed, distraught, and just in disbelief. And this doctor, he didn't even address me, Penny, when he said it. He addressed my husband. So I left that consultation. I refused to be examined. Fortunately, we saw a different consultant who was amazing. And she's just been fantastic in every single way possible. She diagnosed me, treated me, and I've been able to make a fantastic recovery. It's taken a long time, but I've been able to learn a huge amount as I've gone along. But when I came out of that horrendous consultation and I walked into the waiting room, I saw other women standing there because they weren't able to sit down. I saw other women in significant pain, wearing the uniform that we all wear, which is long floaty skirts or dresses because you can't tolerate trousers. And I thought to myself, what if one of those women goes back in and sees that doctor and their husband or partner isn't as supportive as mine?
Wow.
What if that woman goes in there on her own and just gets this dismissive, misogynistic response? And it was that turning point, Penny. I just thought something has to change. So
Yeah.
I did.
Good for you.
Yeah. So I went back and I decided, in conjunction with the consultant gynecologist, dermatologist, specialist nurse, and other patient reps, that we were going to create a support group. And we created the Manchester Vulval Support Network. And that group successfully ran up until COVID. And it was fantastic. It was attended by women from all over the northwest of England, really well attended. And we had fantastic guest speakers, empowering women to learn how to effectively manage their conditions. And then I also, because I was too unwell to go back to my nursing job, which was devastating at the time, and I decided I still wanted to be involved in healthcare and in some way use my skills to help improve the situation for other women living with this condition. So I trained as a hypnotherapist, specialised in persistent pain management and female health issues, and also trained in mindfulness practice. And so I now have my own practice where I support women, not only in the UK, but all over the world online as well. And that's just phenomenal to be able to share my professional expertise and knowledge to support women in this way. So that's how I got into it. And then along the way, I kept thinking, what did I need back then? You know, what would have helped me? And then in conversations with my wonderful patients, they've encouraged me to write my book. So the book is quite literally the book that I needed when I was suffering with persistent vulval pain and it's the book that my patients have asked me to write, and the response has been wonderful.
Oh, I'm so delighted. Well, I'm delighted, Heather, that you are better and you've
Yeah,
recovered.
thank you.
But I am disturbed at that exchange with the gynecologist, but not massively surprised, unfortunately. And
Mhm.
I'm also just surprised at how many women suffer
Mm.
with this and how little it's spoken about. And does it all start the same way, or how can we prevent this, or what should we be looking out for as women?
Okay, so there's a few different things there. So in terms of what causes it, there's lots of different causal factors, and every single woman is unique. The thing that we often find is that there's multiple factors that have come together to cause it. So for some people, it could be hormonally related. So we typically can see pain in times of perimenopause and menopause. It can also be caused, as I mentioned before, by simple infections such as fungal infections like thrush. Um, it can also be caused by any sort of trauma, such as trauma from birth, delivery. There's so many multiple factors. So there's lots of things we can do to optimize our vulval and vaginal health. So I think the biggest thing to get across is that the vulva and vagina do not need fragrances. They have a natural odor, and they don't need covering up or masking with highly perfumed products. So avoiding things like fragranced wipes or things like bubble bath, bath bombs, fragrance shower gels, all that kind of thing. It's far better to avoid those. And even things like lubricants, some of them say that they're vagina friendly, but actually some of the lubricants also include harmful chemicals or fragrances.
Mm.
So just be really aware of what you're putting down there.
And when I was younger, we used to hear a lot about cotton pants, and
Mm.
that you should always wear cotton pants and not, like ease up on kind of tights and nylons and things like that. Have you got any advice around clothing and things? And again, with
Yeah,
sleeping covered up down there, maybe that's not a
yeah,
good idea as well.
yeah. So, yeah, in terms of underwear, it's a great question. And things like cotton and silk are preferable fabrics for underwear. Try and avoid synthetic fabrics such as nylon, polyester, that will make the area sweat a bit more. Um, Style of the underwear varies from person to person. Some people find that thongs are much more uncomfortable, and there's varying research about whether thongs contribute to things like urinary tract infections as well. But people with vulval pain conditions tend to prefer knickers that don't have harsh seams that affect or cause pain in that area. And they also prefer things like shorts or fuller briefs.
Right. So just to be mindful of that, particularly if you feel anything coming on or you're getting recurring um, thrush or UTIs.
Absolutely. It's just well worth considering. If you've got knickers that hurt and cut in, then
Mhm.
obviously that can be contributing to your pain. So just making sure that they're comfortable, that it's a fabric that is optimal for your vaginal and vulval health, like cotton or silk, and making sure they're a style that suit you. Far more important than the look, really.
Yeah, absolutely. And Heather, how do you think we've got to this point where women don't know about vaginal and vulval health? What is missing from our basic knowledge here?
It's a really interesting question because there's been such advances in terms of sex education in schools and the way that, we're more open in talking to young people, but it's as though it's the last taboo. So male sexual dysfunction and male anatomy is talked about far more. In terms of females, we've got better at talking about things like menopause and better at talking about things like periods. But when it comes to female sexual dysfunction, female genital pain, it's just not talked about. And I think there's varying reasons for it. There's still, unfortunately, some shame, embarrassment, stigma around it. Some people are offended even by the words vulva and vagina. And so you find that people use euphemisms for the area, calling it things like flower or tuppence. But that can actually cause problems as well, because then as women, if we're not empowered and we're not educated to know the names of our intimate anatomy, if something does go wrong or something feels uncomfortable, we might not be able to express that to whichever doctor or health professional we're seeing. And that can cause some confusion. If you say that your pain's just down below, then they might think that that's in your back passage rather than in your vagina or your vulva.
Yeah.
So it's so important for us to be educated, be empowered, and also know what's our normal. That's hugely important, because we talk about breast self-examination and we talk about checking our poo, but nobody talks about checking your vulva.
Yeah, it's true.
You just don't. So more recently, I've seen on Instagram, vulval cancer awareness. We start getting some posts coming through, which is brilliant. But in terms of in the general social media and general public awareness, there's so much work we can do to increase women's knowledge and start encouraging women to get to know their own intimate anatomy. Because then when you know you're normal, you know what you look like, you're more likely to identify changes at an earlier level. And then if you go to the GP or sexual health clinic or practice nurse, etc., the earlier things are identified, the more easily things can be treated.
Absolutely. So we need to be speaking to our daughters and passing the word on.
Absolutely.
Like say, I remember when I was younger and puberty, maybe sex education about using, not using fragrance products
Mhm.
to wash and not to wear nylon and things like that. But it's obviously changed, hasn't it? And if anybody wants to work with you, Heather, or buy your new book, where would they go to find you?
So I'm delighted the book's on Amazon. It's also available in Waterstones. You can go into Waterstones and order it from the shop. It's also available online, and it's available in America as well on Barnes and Noble. So yes,
Oh,
yeah.
that's fantastic. And if anybody wants to check out you and your clinic, what you do, where would they go for that?
So I have two websites. There's femalehealthhypnotherapy.co.uk, and then there's heathercoppard.com.
Brilliant. Heather, thank you for talking so beautifully and eloquently about this today.
It's a pleasure, Penny. Thank you for having me.
Thank you so much for joining me on today's episode. I've had a great time. I hope you've enjoyed it. And again, I would love to hear back from you. So all that leaves me is to say, have fun, be happy, and join me next time. Don't forget to hit subscribe for all of my episodes.